Hello, this is Dr. Feast Price, and I'd like to continue our lecture for week one as it relates to the group counselor. It's really important that we understand who we are as counselors and who we are as individuals, what knowledge base we bring to the group context, as well as what life experiences that shape who we are. One of the things that's really essential about the role of a counselor is that it's not totally prescriptive. So who you are as an individual, your personality, your style, your way of working with individuals, your world views, some of your life experiences, all are an integral part of who you are and what you do in the counseling context. And so what I'd like for us to do is focus this lecture on understanding the group counselor. One of the things I would like to add about myself that I failed to mention in my introduction is that I am a clinician. I am a practitioner. I have a small private practice where I provide individual, family, and group therapy. I love working as a practitioner. I'm always privileged when I work with clients and they feel comfortable with me and entrust some of their most private life experiences with me. So I never take that for granted, and I thoroughly enjoy the work as I do as a clinician. So some of the things that I'll be sharing with you in this unit, in this lecture, as well as upcoming lectures, has a lot to do with who I am as a clinician, what I believe personally as well as professionally, and how I work with my clients. And so from the group context, I work with a lot of nonviolent ex-offenders. I have a background in working in correctional settings. I worked in the state of Kentucky at a state correctional facility for some of the most psychiatrically impaired inmates. And I've also worked for a federal prison where I worked as a psychologist on a treatment unit and provided mental health to both individuals as well as groups. So I have those experiences, and in terms of my expertise, I enjoy working with persons with anger management kinds of issues as well as survivors of trauma. So that's just a little bit about who I am. The objectives for this course is to orient you to the counselor as a person. By doing so, I'd like to help you to understand some of the problems faced by beginning group leaders. So I know that if you are aware of some of the problems, then that it's less likely that you will have some of the same problems, and you might be able to avoid some of the pitfalls that are common among some of the beginning group leaders. Also, some of the personal qualities that are believed to be most effective for leadership, the group leader as a professional, which will include some of the specific skills of group leaders. I'd like to talk about issues related to diversity and being a competent group counselor. And then I want us to talk about co-leadership practices. We're always fortunate when we are able to have a co-leader in a group context. However, there are some advantages and disadvantages associated with those. And so I'd like for us to look at some of the advantages and disadvantages of co-leadership in the group process. So in the coming slides, these are the objectives that I'd like to accomplish for your lecture, your second lecture for week one. So the group counselor as a person. You know, it's really important to recognize that the extent to which a counselor, a group counselor, or even an individual counselor can be effective is predicated on their ability to establish a solid relationship with the persons with whom they work. So in a group therapy context, the group leader, the group counselor, is only as effective as their relationship that they have with the members. So if there is no trust, if there is no respect, if there is no relationship with your participants, your ability to impact change within the group and also to be an effective leader will be limited. So relationship is key. And as one of my colleagues always says, relationships trump skills. If you are an effective leader in terms of having a solid relationship, even if you don't have the best skills, you don't have the best tools and techniques, if you have an ability to connect with your participants, your ability to be an effective therapist is far improved. And to the contrary, if you have the best tools and techniques and you have mastered them with great precision, your ability to positively impact the lives of your group members or in individual therapy, your client, is very limited if you don't have the relationship that would allow them to trust you and to believe that you can assist them. So I just want to emphasize that you have to have really good interpersonal skills that allows you to establish a solid and trusting relationship with the participants. You must also, as an effective group counselor, be able to attend to your own vitality and self-care. One of the things that I have noticed in my years of working as a clinician is that if you are not healthy, if you are not healthy as a clinician, if you are not emotionally intact, it is very difficult to be an effective clinician. You will have issues with boundaries, you will have ethical kinds of issues, and so it's always important as a clinician that you attend to whatever your own issues are. If you have issues related to marital problems, self-esteem issues, you have to get those taken care of, because if you are not a healthy clinician, it is very difficult for you to be your best self. And also, you will be challenged. You will be challenged in terms of issues related to transference and countertransference if your vitality and self-care is not in place. So just be mindful of who you are, how you're feeling, whether or not you're feeling burnout, whether or not you have personal issues in your own personal life that must be attended to in order for you to positively impact the lives of the clients that you'll be working with. You also must pay attention to how you deal with stress and anxiety. If you are going through a very stressful time, it's important that you pay attention to how those stressful situations are impacting who you are, because especially in a group process, you have to be in tune with your clients. You have to be aware of multiple things that are happening simultaneously, and if you're distracted with stress and anxiety, it is very difficult for you to pay attention to your clients and to what's going on. And that is especially important if you are the only therapist in that context. If you don't have a co-leader, you really have to have your wits about you, and you have to be able to pay attention to multiple things. So be aware of what your stress and anxiety levels are, and when they are to such an extent that you cannot pay attention to your clients, or you may be vulnerable, you must make sure that you receive the support you need, or find another therapist that might be able to step in and assist or take over the group context. Some of the benefits of being a new group leader is that you're very energetic, there's a lot of creativity, there's a strong drive to be helpful, you're not jaded by the process, there's a drive to succeed. And so a lot of times when I work with new group leaders, it's very exciting because they bring a certain level of excitement and creativity and energy that can help therapists that have been in the therapeutic process to reinvigorate. And so I really enjoy working with new group leaders, and they are also very creative. They're able to think out of the box. They're also less able to use things that are status quo. So there is a lot of benefit to being a new group leader. But as with everything, along with some of the benefits, there are also problems as well as some pitfalls. And so some of the problems that are common among new group counselors is that sometimes they have very limited insight. They, while they may be insightful, there are times they may be insightful, but when they are insightful, they're less likely to share their observations because there's not the comfort or confidence associated with putting out their whatever they're thinking or feeling. And so there are times when I have worked with new counselors that sometimes they lack the insight. They see things on the surface. A client may say one thing, and behind that simple statement is a whole lot of other information that you might have to consider or delve into. And so sometimes with clients, I find that they look at the surface when hearing problems that a client are presented with. There are times when clients are insightful and they might see things that clients are presenting, and they can see things below the surface, but because of the lack of confidence, they're not as willing to share some of their observations. There may also be negative reactions from some of the members. One of the things that I find in working with some of the ex-offenders or persons that have a history of substance abuse, they always want to know, have you ever experienced issues related to incarceration? Have you ever been incarcerated? Do you have a substance abuse problem? And if you say to them, no, I haven't, sometimes excuse me, there is the perception that because you've never had the experience, you don't have the expertise to bring to that situation. But because you've never had a head injury doesn't mean that you can't help someone with a head injury. Because you've never had an eating disorder doesn't mean that you do not have the skills and expertise to help persons with an eating disorder to overcome those issues. So there are times when there are negative reactions that come from members of the group, and you have to have the wherewithal to deal with some of those negative reactions from group members. I also think that you have to be able to challenge group members with working with ex-offenders and as well as persons with substance abuse histories. They will challenge you as a leader, as a facilitator or a counselor, and you have to be able to withstand some of the negative reactions that you receive from the members, and you have to be able to confront some of the negative behaviors. And so along with being a new member, you have to be comfortable with negative reactions. You have to be comfortable with challenging persons that might present with issues that demand confrontation, and you also have to deal with conflict. So you have to be able to be confident in your skills and abilities as a counselor. Sometimes new counselors get discouraged quick and they want to quit. There are times when I've worked with difficult populations where they do sometimes bring their negative experiences to the group context. You can't take it personally. You always have to understand that it is not about you. It's more about the people that you're working with than it is about you as a counselor. So you can't get discouraged. You can't take it personally, and you definitely cannot quit if you want to become a seasoned clinician. So you definitely have to have a thick skin, and you can't internalize or personalize some of the things that your members of the group might present and might direct your way. The other thing that is often seen, or some of the problems that might be seen with new counselors, is they must have the wisdom of seasoned group members. So their experience must be guided by a seasoned group member so they can observe how a more seasoned leader will respond to conflict, confrontation, negative emotions, or issues that occur in the group context. And so it's always important that some of the newer counselors are partnered with some of the seasoned counselors. And what I find is that it is a reciprocal kind of relationship, because as the new counselors bring that excitement, enthusiasm, and some of the out-of-the-box thinking, the seasoned group leader is able to help the new counselor understand how to deal with some of the more challenging issues that relate to some of the negative reactions of the group member, as well as challenging some of the behaviors of the members of the group. So there are key attributes that are very important to an effective group leader. And these are attributes that are personal in nature. They might be consistent with who you are and your personality, but you definitely have to have courage. You have to have courage to say what you think, to probe and ask questions. You have to have the courage to be comfortable with difficult communications, different kinds of emotions. So you definitely have to have courage. You have to be a model. You have to have a willingness to model different kinds of behaviors, to role play, to react in ways that allow the participants to see effective communication styles. Because one of the things I'm always cognizant of is that I am constantly being observed and watched by the members. The ways in which I handle difficulty that exists within the group, conflict. Sometimes participants ask questions, well, how do you handle this? Have you ever had a particular situation to occur? I believe in sharing with participants to the extent that it will help them to better themselves. The group context is really not about the leader, it's about the participants. So there are times when members ask questions or certain experiences that I've had I can share with the participants or the group members, but it's always about their benefit. So I ask myself, is what I'm about to share relevant to the participants? And to the extent that it's relevant, and it will help to promote growth with the members of the group, then I will share. Because as a group leader, you're a part of the group to the extent that you're a leader, but the group is really not about you, and it's not for you, it is for the participants. You must be present. You have to have a sense of presence in the group. So when you have issues that might be stressful or anxiety provoking at home, you have to leave those issues outside the door, especially when you are the only member or leader in the group. If you have a co-leader, then there's an ebb and flow that exists among group members. But with limited budgets at many agencies, oftentimes you are the one and only group leader. And so you have to have a sense of presence. You have to be not only cognizant of what's happening in terms of what's being said verbally by the person that is speaking. You also have to pay attention to nonverbals. You have to pay attention to the person that's speaking, as well as how other persons in the group are responding or receiving some of the information. So, for example, if I'm in a group and I have someone that is saying something that is relevant or is sharing, I'm always noticing what the other group members are saying. Some group members might shake their head in affirmation, and I'll give them an opportunity to share their thoughts or feelings regarding what was said. And you might have some others that become closed or might shut down or may not be in agreement, and I'll give them an opportunity to share their thoughts or feelings. So I might say, well, Jason, I noticed that when Mark made that statement, you were nodding in agreement. Tell me what about his statement that you could agree with. Or for someone else, Janice, I noticed when Mark made that particular statement, you were in disagreement by the way you were shaking your head. So tell me, what was it about what he said that you can either agree or disagree with? And tell me how it's relevant to you. So you're always paying attention to other members so that you could bring them into the discussion. So presence, you have to have a sense of presence and be alert to what's going on around you. Goodwill, genuineness, and caring. And that goes back to the relationship. If you are not genuine and caring and doing the work that you're doing from a place that you value the human beings that you're working with, then you will not be as effective. So, you know how Rogers talks about the essential ingredients of the helping relationship: unconditional positive regard, empathy, genuineness. Those are all essential in a group context. And so as a leader, an effective leader will have goodwill, concern, and consideration for the person that they're working with. They will be genuine and authentic. And they're also caring. They care about the people with whom they work. There is a belief in the group process. You have to believe that what you're doing in the group process is very important. And what I have come to believe and appreciate is that in many instances, the group process can be far more effective than individual therapy with dealing with certain kinds of issues. And so you have to believe in what you're doing, because if you don't believe in it, trust me, the members will see it. And if you're not bought in, they won't buy in either. Openness and transparency. There has to be a certain level of openness. As a therapist, you too have to have a certain level of vulnerability so that you can receive and hear what your participants are saying. You can't sit there like a blank slate where they are giving and sharing of their emotions, concerns, life experiences, and you're just kind of sitting there taking it in and not really hearing them from an emotional place. So you have to be open. You have to not only hear what they're saying, but also you have to empathize. And part of empathy means that you can put yourself in the shoes of that person and have some idea of what they were feeling or experiencing. So openness is a necessary ingredient in being an effective group therapist. You have to be non-defensive in coping with criticism. There are times when I have had group members to criticize me, confront me because I haven't had certain kinds of life experiences. They believe my life is a perfect life, and what do I know about what it's like to be poor? What do I know about what it's like to have be addicted to drugs or alcohol? And so you can't take it personal. But yet, even with the criticism, you have to help to impact the fact that even though you may not have done drugs or you may not have had certain life experiences, it doesn't mean that you cannot be empathic, you cannot be genuine, and you cannot have unconditional positive regard. And so when clients understand that despite your lack of certain experiences that you can be effective, then you can move them from where they are to where they need to be. But you definitely have to be available to receive criticism and not take it personally. You also have to be aware of subtle cultural issues. Certain kinds of issues clients of certain cultural backgrounds will not talk about. There are certain ways of communicating that might be specific to certain cultures. And so you always have to be aware of some of the cultural nuances that exist within your group that might be relevant to socioeconomic issues, might be geographical, might be specific to gender or race or geographical location. So be aware of some of those subtleties as it relates to one's culture or the culture of the group. Being able to identify with a client's pain. I spoke a little bit ago about empathy, and empathy means that you can imagine what the client is experiencing as a result of envisioning that you were in a similar kind of experience. So with empathy gives you an ability to identify with your client's pain. So while you may never know firsthand what it's like, you can imagine what it would be like if you were to experience that same issue and what that pain might be associated with that issue. So putting yourself in the client's situation and being able to identify with the client's pain is very important with being an effective therapist and group leader. And it's also consistent with what Roger says about being empathic, and when he talks about the key ingredients to being an effective therapist and moving a client from where they are to a place of self-actualization. You must also understand your personal power as the therapist. You are developing these relationships. You are hearing information. For some persons, it is the first time they have ever had a positive relationship that was healthy. And so you have to understand, first of all, that you must be mindful of your relationship with the client. There are sometimes issues of transference where clients believe that because you are empathic and have unconditional positive regard, they might misconstrue that as you having some kind of personal interest in them. And so be mindful of your personal power. Never take for granted when clients trust you and their relationship to such an extent that they will share some of the most private and painful experiences that they may have ever shared in their lives. And so be mindful of the position and power that you have in that therapeutic context. You also have to have stamina, because I know most groups are 90 minutes in length. And so to have your wits about you, to be paying attention to multiple things going on simultaneously, multiple people, both verbal and nonverbal communication, making sure all members of the group are participating and engaged. It takes a lot of work and a lot of effort. So you definitely have to have stamina to do the work that you do as a group therapist. And this is especially important when you don't have a co-leader. Stamina becomes very, very important. And what you'll find is most often than not, in most treatment settings, you will be the only leader. You will not have the luxury of having a co-leader. And so that is another reason why stamina is very, very important in that context. A commitment to self-care. You always have to ask yourself, how am I feeling? Am I stressed? Am I riddled with anxiety? Am I feeling healthy and happy? You know, pay attention to your emotions as you're preparing for your group, that you're driving to the group setting, when you're walking there and leaving there. Pay attention to your own internal signs, so that if you are feeling stressed out, if you're feeling overwhelmed, if you're going through certain life experiences, because life doesn't stop just because we're a therapist, if you're going through certain issues, make sure you get the self-care that you need so that you can adequately care for the clients that you're working with, and that your health and well-being is maximized, because you can't take care of others if your own well-being isn't cared for. I remember working with colleagues that were going through divorces, and for anyone that may have been through a divorce, it can be a very stressful time. I've never been through a divorce, but from the clients I've worked with, from friends and family that have gone through divorces, I know that it can be a very debilitating time in one's life. But I respect my mental health colleagues who recognize that, you know what, I cannot work as a therapist. I have to do some self-care because I don't have all my faculties, all of my wits about me, and I will not be able to give to my clients what they're needing. So they pull back from therapy. They might turn their caseload over to other therapists so that they can provide to clients what they need while therapists work on themselves. Self-awareness. Be aware of what emotions you have within the group context. I never will forget the time I worked in a prison setting, and I was doing a group with some guys that were in a residential drug abuse program within the prison setting. And one of the guys, I inherited the group, so it wasn't a group that I established. I stepped into the group context after another therapist left. And one of the assignments that one of the group members had was to read a letter. The letter was a farewell letter, and it was a letter that he had to do that was assigned by the previous therapy before he ended the group process. And so he said to me, as the group leader, I was the only leader in the group, he said, I have a letter that I need to read to the group as part of my treatment plan. And I said, okay, sure, you have the floor. And so he told about the letter. He said, this is a letter that I wrote to my mother. My mother died X number of years ago. It was a pretty recent death, like maybe 2 years ago, but the client had never dealt with the death. And part of some of the self-destructive behavior that he was engaging in was acting out behavior because of the void that was created with the loss of his mother and not properly grieving the loss of the mother. And so he wrote this letter saying goodbye to his mother. And at the time he was reading this letter, it had not been long since my own mother died. And so he was reading this letter, a very heartfelt letter about saying goodbye and remembering the times as a kid when his mother was a bus driver and how he would sit behind her and how they would share conversations and meals and talk, and what a major influence she was in his life and what it was like for him to say goodbye and all the things that he would miss. And while he was reading this letter, I was thinking to myself, okay, don't cry. Focus on the client. This is not about you. Focus on the client. Focus on the group. This is not about you. And despite my best ego strength to keep it together, I started tearing up and tears started flowing from my eyes as he was reading his letter. And so anyone, who could hear a similar situation can be evoked emotionally as well. For me, I wasn't prepared. I wasn't aware that was coming, because if I was aware, I could have been more in tune with my own emotions and prepare myself. Okay, this is what he's about to say. It might evoke certain emotions associated with your death, the death of your mother. I could have gotten myself ready. Needless to say, I didn't get myself ready. And so I emoted in the group. I wasn't crying all over the place, but I did tear up. I did have tears that flowed. And so I apologized to him. I apologized to the group. We focused on him and what the letter meant to him. And because the group members were wondering, well, why, what's going on with Dr. Price? Why is she crying? I shared briefly that my emotions were triggered by hearing, the member talk about his mother and that my mother had recently died, but we shifted the focus back onto the client and what he was going through. I know that there are certain vulnerabilities that exist when you show your humanness to a group. But I also know that when your clients see the humanness in you, that it lets them know that you too you're not a machine, that you have certain emotions. And so you definitely have to recalibrate and maintain your professionalism excuse me, in the group context. Because at the end of the day, groups are not about the therapist. It's not about the group leader. It is about the members. And so any credibility that you might lose from having an emotional reaction, you definitely want to regain by making sure that you are professional. And so that's, the long and short of talking about the importance of self-awareness. But even in your best moment of self-awareness, there are times when you may have a reaction to your client, but you have to make sure that while that may occur, you definitely have to recalibrate and reposition yourself as that of the professional, the leader, and the facilitator of the group. A sense of humor is always essential. It's important that you're able to laugh with your group members. Sometimes humor can be appropriate to help them to find humor in situations that they might be oversensitive about. And it's also important to let your participants laugh at you and you laugh at yourself sometimes, because sometimes I find, especially with working with ex-offenders or persons in correctional settings, they lose their sense of humor. Life has become extremely serious for them, and it's important to help them to recognize the importance of a sense of humor in a therapeutic setting. Inventiveness, you have to be creative, you have to think out of the box. I especially like inventiveness when we're doing role plays and we're reenacting certain situations, and how when you're inventive, it's another way of evoking emotions within the group. It's another way. It takes evoking emotions to a whole different level when you can be inventive, and it's not just talk therapy, but you could do role plays, or you could reenact certain situations. Psychodrama is one of the ways in which therapists can be very inventive and use different strategies and techniques to bring about cathartic reactions within their clients. And there must also be a personal dedication and commitment to what you do. If anybody who is in rehabilitation counseling or provide any kind of counseling for monetary reasons, they're doing it for the wrong reasons. We know we never get paid the extent to what we deserve, but you have to do what you do from a personal, dedicated, and commitment point of view. You have to be dedicated and committed. And so it's from that point of view that you do the best work, because clients know when you're not doing it from a very sincere and genuine place. So this is a really important list of some of the personal attributes of effective group leaders. And I encourage you to think about some of those areas that you might fall a little bit short, and think about ways of enhancing some of your own personal attributes in order to positively impact the group process as a group leader. The group counselor as a professional. A therapeutic relationship is necessary but not sufficient to produce change. And so there is a body of knowledge that speaks to treatment skills that are essential in being an effective professional. So yes, while you want to have Roger's 3 necessary ingredients for the therapeutic process, you also want to have knowledge and skills to help participants to become self-actualized, to expand their knowledge base, to change their behaviors, and as well as to problem solve. For me as a therapist, I'm a cognitive behaviorist, and cognitive because I always think it's important to understand the cognitions, the thoughts associated with the way a person is feeling, And I also think you have to change behavior, because at the end of the day, if you have a relationship and you understand their cognitions but the behaviors remain the same, then the client is very limited in their ability to change. And so I always think, as clinicians, you want to, at the end of the day, you want to give your clients skills so that they can change their behavior. You want to impact their knowledge. And so those are some of the things that are essential to the group counselor as a professional. So number one on the list is skills that exist on a continuum of competence. You know, there are a number of skills that one must have in order to be competent. You have to have good listening skills, good problem solving skills, good questioning skills. You have to have the ability to help clients to try new skills. And so there are a continuum of skills that are essential that counselors must have when working with clients. Second, there are skills that can be learned and refined through training and supervision. So these skills allow participants in the group to determine multiple ways of going about behavior change. And so there's no one way of teaching consumers certain kinds of skills. And so it's important to know that skills can be learned as well as refined through all kinds of training and supervision mechanisms. So any skills that you may not have at the present time, through different kinds of learning experiences, you as a clinician can refine and enhance and expand your knowledge base through different kinds of workshops and training programs, as well as through supervision. Group leaders must be able to multitask. I talked about, as a group leader, you have to, first of all, most often than not, you will be the solo leader. You will be the only leader or therapist in the room. Because unfortunately, with managed care and budget cuts, it's unlikely that two skilled clinicians will be in the room at the same time. So as such, you have to pay attention to all of the participants, and usually the ideal number of participants would be 8 to 10 members. So you pay attention to the participants, what they're saying verbally as well as non-verbally. You have to pay attention to the person that's speaking as well as the reaction of persons who are not speaking. And you also have to make note of persons that are disengaging, persons that might be physically present but not mentally present. And so there's a lot that you have to pay attention to all at the same time. It's like, where is this conversation going? Where do you want to direct the conversation? And when we talk about the fact that you have to have stamina, one of the personal attributes of an effective group leader is to have stamina. You really do need to have stamina because you are doing multiple things simultaneously, which can be pretty exhausting. And so I know after I finish therapy, whether it's group therapy or individual therapy, I always enjoy doing mindless things that allow me to decompress, that allow me just to exhale and shift gears, because I notice that if I shower and go to bed immediately after I've had intense therapy, I have a tendency to dream about what occurred. And so I always like to shift gears and do some mindless things before I turn in for the night. Skills are not discrete, but overlapping. So what you find is that when you are multitasking and paying attention to multiple things, it also is helping you to figure out exactly what do you need to do next. So active listening skills, reflection skills, clarifying skills are not they're not independent. They're very interdependent. So by developing certain kinds of skills, you're also automatically improving other skills. So just know that skills are not unidimensional. They overlap a great deal. And so skills that you develop in one area definitely positively impact skills in other areas. Number 5 talks about skills that cannot be divorced from who you are as a person. If you have a lighthearted kind of personality, if you are engaging as an individual, if you enjoy people, if you are socially awkward, if it's hard for you to warm up to people, if you don't like engaging with people, all of those things come out in a counseling context. So you cannot divorce who you are as a person from who you will be as a counselor. But I think what's also important is to recognize what are some of your shortcomings and identify ways of improving and enhancing some of the skills and traits that you bring into the therapeutic setting. Number 6 says that the skills you develop and use are an expression of your personality and leadership style. And I believe that to be true. For me, I am, by nature, I'm a lighthearted kind of person. I love to laugh, but I know that there's a time to laugh and a time to be serious. I enjoy engaging participants and making them feel comfortable. I'm an inquiring kind of person, so I enjoy asking people different kinds of inquiring questions. I also enjoy getting people to look at things from different kinds of positions or points of view. And so what you'll find that many of you come to counseling because even before you decided to pursue your MRC, you already had been told by people that you have good listening skills. I enjoy talking to you. You might be the problem solver of the family. You might be the one that helps the family to make different kinds of decisions. And so many times you have a personality and a leadership style that is already somewhat developed, and you'll find that when you're working with your consumers or your clients or your group members, who you are will come out in the group context. And so we don't leave who we are outside the door. It comes in with us. But it's important to recognize is that if there are certain aspects of who you are that can impede the process, then you need to be aware, and then you need to work on improving or enhancing your skills and abilities. So what I'd like for us to do is talk about some of the skills of a competent group leader. And with the skills that I'll be discussing with you, none of them are skills that you haven't heard about. So in your Theories and Techniques 1 course, as well as your Theories and Technique 2 course, these are some of the exact same skills that we've talked about before. And so what you will find is that irrespective of whether you're providing individual therapy or group therapy, some of the essential skills of being a competent leader or therapist will not change. And so the very first thing on the list is being an active listener or active listening. Active listening is really, really important. And in fact, it is considered the most important factor in allowing you to figure out what the issues or concerns are that your client is presenting to the therapeutic context. So it involves absorbing the content, noting gestures and subtle changes in voice or expression, and sensing underlying messages. So it is most important to learn how to pay full attention to others as they communicate, as well as how to not only listen to words, but also pay attention to some of the nonverbals. So group leaders can improve their listening skills by first recognizing the barriers that interfere with paying attention to others. And some of these roadblocks are not really listening to others, but thinking about what to say next instead of giving your full attention to what the client is saying. So being overly concerned about your role and function, how you will look, judging and evaluating yourself without putting into place what it is you want to say. So you want to just think about exactly what it is you want to say, and say it rather than analyzing and assessing and screening yourself. You want to feel comfortable presenting your perspective, and sometimes you'll find that it'll go over well with clients, but sometimes clients may not necessarily agree, or some will and some won't. But there's a certain level of awareness that must be in place when you are an active listener and hearing not only what clients are saying in words, but also in terms of their nonverbals. Another important skill to being an effective and competent group leader is reflecting. And reflecting, which is a skill that is dependent on active listening, is the ability to convey the essence of what it is a person has communicated so the person can see it. And so sometimes a client may say certain things and you will reflect back to them exactly what was said. And in that process of reflecting, a client might come to the realization that what they're thinking or feeling may not be the most effective way of thinking or feeling. So they might change their perceptions or their thoughts or feelings as a result of hearing back from someone else exactly what it is they said. So clarifying, I see that I omitted clarifying, but clarifying is also another important attribute. And so sometimes you just have to ask the client, help me to explain, help me to understand exactly what it is that you're saying or you're feeling or you're experiencing. So a clarifying question is also a question that's important. Summarizing. After you've had a very important discussion, you always want to tie together what was discussed in a clear and concise manner and give the client an opportunity, the participants an opportunity to hear back what the key issues are. So I always envision it as a balloon with lots of different strings. And so there were lots of things that might have been said both verbally and non-verbally regarding a particular topic. And so like the long strings that hang from a balloon with helium, you're just taking the strings and you're joining them together and maybe tying it up in a nice bow. But what you're doing is kind of tying in all of the relevant information to a clear and concise way of understanding what was communicated. So summarizing is a very important tool to bringing together lots of different thoughts and ideas and kind of summarizing it and closing the information in some succinct kind of way. Facilitating is another important skill, and group leaders can facilitate the group process by first assisting members to openly express their fears and expectations, and number two, actively work to create a climate of safety and acceptance in which people can trust one another and therefore engage in productive interchanges. So also you want to provide encouragement and support, because sometimes the group members are exploring issues that are highly sensitive. You want to involve as many members as possible in the interactions and invite and sometimes challenge members to participate. And this is especially important when you see some members of the group disengaged and not fully in tune to what is going on. You also want to work toward lessening the dependency on the leader by encouraging other members to speak directly to one another. And then you want to help members to overcome barriers to direct communication. So sometimes members of the group might feel a little bit uncomfortable directing their comments to other members because it may not feel as comfortable. But with a little bit of encouragement, it's really the most effective ways of communicating. And so the aim of most facilitation skills is to help the group members to reach their own goals. And these skills involve opening clear communication among the members and also helping them to increase their responsibility for the direction of the group. And so it's not necessarily the role and responsibility of the group leader to do all the work. It's really, the most effective groups happens when the group members all are actively engaged to such a point that they are leading and facilitating and challenging each other to get involved in the group process. With regard to interpreting is when the group leader hears necessary information and draw conclusions and inferences from what has been communicated. And so interpreting is really important because sometimes in the process of interpreting what was communicated by a particular group member or the group as a whole or multiple members, sometimes when you summarize and share with the group what your interpretation is, you might find that what you interpret might be a little bit off base. And so then members will clarify and share relevant information to make it more accurate. So interpreting is a really important part of what the skill set is that a leader must have, because sometimes your ability to interpret might not be consistent with what a member of the group is actually communicating. Questioning. Questioning is another essential tool for a competent group leader, and sometimes questioning is overused by group members. And interrogation seldom leads to any kind of productive outcome. And more often than not, questions become distracting rather than effective ways of getting persons to really fully understand. And so sometimes you will have to ask questions to clarify and to get additional information, but you really want to avoid doing a lot of questioning because there are times when too many questions can take away from the therapeutic nature of the group. But we do recognize that there are instances when you have to ask a clarifying question so that you can best understand exactly what is being communicated to you. So linking is also important, and that's a skill by which the counselor links relevant information that has been communicated to the group. So it's interactional in terms of its focus. And so it stresses that from member to member rather than from leader to member, the communication is linked together. And so it's connecting what multiple members of the group might be saying. So, for example, if 3 people in the group have said something, and albeit slightly different, you might figure out ways of connecting and linking some of the thoughts and getting other people to either add comments, expand what was said, or figure out if it is on point or accurate in terms of what is being communicated and what are the most germane kinds of issues that are presented. Confronting is a skill that sometimes must be used in a group context, and sometimes beginning group leaders are sometimes afraid to confront group members because of fear of hurting their feelings or being wrong, or the fact that it might initiate some form of retaliation. But confrontation skills or confronting skills are very important, because in confronting a member, a leader has the ability to help them to recognize sometimes behaviors or thoughts or feelings that might be counterproductive. And so a lot of times people see the term confronting as a negative, but I don't think confronting is a negative. I think it's really just helping to expand the knowledge base of a group member. It's helping them to go from where they are to taking their thinking to another level. And sometimes it's taking their behavior to another level, because clients are not always aware of some of the roadblocks that exist, so, or that they are presenting. Sometimes there might be some self-sabotaging behavior that clients may not be aware of. So I think helping clients to see beyond their blinders, because we all have blinders, and confrontation skills is one of the ways that we can help clients to remove the blinders that they might have. Supporting is always important. You want to be supportive of your clients. You want to let them know that the work that you're doing with them is from a place of caring and from a place of wanting to help them. And so it's important that as a therapist or as a group leader, that you are supportive and you do present with supportive behavior. We know that being supportive can be either therapeutic or counterproductive. And so sometimes a common mistake is offering support before a participant has had an opportunity to fully experience a conflict or some painful feelings. And so while you want to support the client, you don't want to be over supportive, and you want to challenge them so that they can grow, because sometimes through difficult situations is when clients grow the most. Blocking is when the group leader uses certain kinds of activities to help group members to see things more clearly, to allow them to kind of remove the veils that exist. So such activities as questioning or probing or gossiping and invading another's privacy, breaking confidences, those are some of the ways in which clients can be blocked. You know, it blocks their ability to actively engage and actively participate in the process. But helping clients to remove their own personal blocks, their own personal limitations, is an effective way of helping them to move from where they are to a higher level of functioning. So sometimes blocks are presented by other members through issues related to gossiping or, invading the privacy of others. But sometimes clients might block their own growth because they're not actively engaged in the process. So for whatever reason you witness blocking as a leader, then you want to help to overcome those issues. So you want to assess what the problems are, be able to identify what are the issues, what are the causes of the blocks. And so once you can assess those issues, then you can help the client to overcome blocks that are limiting their ability to actively engage and effectively participate. I mentioned a little bit ago about modeling, and modeling is really important. It's one of the best ways that as leaders we can teach our participants desired behaviors. So some of the attributes that are really important, in addition to the ones that we have already talked about, is encouraging risk-taking, helping with openness and directness, helping our clients to be sensitive and honest, respectful, are all ways in which we are modeling to our clients appropriate kinds of behavior. So I'm always cognizant that clients are watching, and as a model, not only as a leader, but as a model, it's important how I function in the group context as well. What are some of the lessons that I'm teaching the clients or the group members as a result of my behavior? Suggesting is another important skill that is important to a competent group leader. Sometimes you have to make suggestions. You have to suggest that the client try certain kinds of skills that they may not have attempted before. And so when you're an effective group leader, sometimes you have to make some different kinds of suggestions to help the client to improve their thinking, feeling, and behaving. Initiating occurs when the leader takes an active role in providing direction to the members. It offers some structure, and it takes action when it is needed. And so the group is aided in staying focused as well as being on task. So one of the skills of an effective group leader is to get members to focus on their personal goals, to assist the members in working through the places where they're stuck, also helping members to identify and resolve conflict, knowing how to use different kinds of techniques to enhance work, and provide responsibility for directing themselves. So we also have to recognize that too much leader initiation can stifle the creativity of a group. But if you have a group leader that takes too little effort in initiation, that can lead to a more passive kind of group process where the group members are not actively engaged because there's no real structure. Evaluating is another important skill for a competent group leader. And so a crucial leadership skill is to evaluate the ongoing process and dynamic of a group. And so after each group session, it's always important for the leader to evaluate what happened, both within the individual members, within each of the individual members, as well as within the whole group. And also to think about what interventions might be used next time with the group, and to get in the habit of asking yourself, how did things go? What changes are resulting from the group? What are the therapeutic and non-therapeutic forces of the group, and how to make the group a better process is something that should always go on. So we know that there are summative as well as formative evaluations, and so with the formative evaluations, it's going on throughout the group process, where you're constantly asking yourself, how's the group going? What can I do better? What can I do differently? What is stifling the group process? So that's more of the formative group process, where you're always asking different kinds of questions during the process to enhance the therapeutic process. But then there are also summative kinds of evaluations that can be done at the end of the group process, where you, at the end of the process, you've determined, sometimes it's through questionnaires with the participants, but you're always asking yourself, at the end of this group, did the participants receive the desired outcome? And so that is summative in nature, that's done at the end of the group process. But both summative and formative evaluations are very essential in enhancing the group and making sure that it meets the needs of the group members. Terminating, there is a skill associated with terminating the group process. And so you need to develop the ability to tell when a group session should end and when individual members are ready to leave the group process. Some groups are more prescriptive, so they might be an 8-week group. But then certain groups, you look for certain kinds of behavior changes. So if there are certain kinds of behavior changes that have been achieved, then you know that that is an appropriate time to terminate. Also, there are times when you have members in a group that might be detrimental to the group process. So in instances like that, you might have to terminate individual members. You might also find, especially where careful screening doesn't take place, that certain members may not be ideal for certain groups. And so you might need to terminate in those instances as well. But whenever termination occurs, especially if it's termination before the treatment goals are reached, you want to always make sure that you provide alternative resources to help consumers or group members meet targeted goals. So termination is very important. The skill of terminating as a counselor is also essential. And I'm a firm believer that you never terminate the therapeutic process the last day. Terminating is it is a sequential kind of process, and it occurs over several different weeks. It's a process. It doesn't happen in one session, but typically it happens over multiple sessions because sometimes consumers have to adjust to the therapeutic process ending. So we talked a little bit ago about co-leaders. And we know that ultimately it's ideal to have co-leaders involved in the treatment process. But we're not always fortunate enough to have co-leaders. But nevertheless, I thought it would be important for us just to talk a little bit about what are some of the advantages and disadvantages associated with co-leadership. And so with the co-leadership model, we know that it is a choice of co-leaders that is extremely important. It's important to identify leaders based upon certain styles. You don't want there to be a clash between the different kinds of leaders. So it's always important that there are co-leaders that complement each other, that you want to make sure that you ward off any potential conflicts. So essential to identifying co-leaders is making sure that the leaders that will be working together can function effectively. And not being able to choose your co-leader can be frustrating, because what it means is that making sure that personality types and style is may not be congruent. So to the extent possible, you want to be able to help to identify the co-leader that will be working with you. Mutual respect is a key factor in the selection of the co-leadership process. And you always want to work out any disputes in a manner that is respectful, and you want to address issues directly. So you want to possess a shared view of the group's basic structure. You want to make sure that you, as well as your co-leader, are on the same page as it relates to running the group. And you also want to be aware of any personal kinds of issues, any personality clashes that can adversely impact the group process. So these are a few of the key issues that you must be aware of when considering co-leadership. So sometimes in co-leadership there are conflicts, but we know that there are effective ways of resolving conflicts to minimize the damage that can be done. So most important is to, first of all, examine the issue, to seek supervision and consultation from others, to communicate your concerns to the co-leader, increase preparation and debriefing time, so the extent to which you and your co-leader can meet prior to the meeting and debrief afterwards means that you can do a far better job of minimizing any kinds of conflicts that could possibly occur. And if you can't resolve any problems that you might have, you definitely want to change the co-leader, because any problems that you might have with working with your co-leader can also negatively impact the group context. And the group members may not get the full effect of the group if the different leaders are having relational problems. So it's always important that if problems exist, that you work to resolve the differences. And once you resolve any differences, then your chances of having an effective group is significantly impacted. So what are some of the advantages of co-leadership? Having a co-leader means that you can reduce the chances of burnout. Remember, we talked about stamina and being in tune and being present. So the extent to which you have a co-leader to assist you in the group, to help you pay attention, to be equally present, means that it is not all on one person. And so there is a luxury associated with co-leadership. And one of the luxuries is that there is a reduction in the chance of burnout. Another important factor in having a co-leader is that multiple group members can be attended to. So perhaps one group leader may pay attention to the person that's talking, and the other group leader will focus on the other members and some of the nonverbals. And so you don't have to do as much multitasking if you know that you have a group leader that can pay attention to certain things, and you would have the responsibility for attending to other issues. There's also the increased likelihood of continuity of services even in the absence of one of the members. So one absent member doesn't stop the flow of the group when you have co-leaders. Also, co-leaders provide peer supervision. So one leader, each leader can provide feedback, support, and insight to the other leader to help them enhance and improve their skills. So there's an opportunity for constructive feedback if there are co-leaders that exist in the group context. It also allows you to minimize the effects of countertransference, because it means that all of the responsibility doesn't fall on one person. And countertransference is another byproduct of having a co-leader in the group context. It provides a differentiation of power and privilege. So it means that one leader isn't perceived as having all the power and privilege, but when it's shared, there are multiple persons within the group that is perceived to be essential and effective in the group context. So like advantages, we know there are also disadvantages, and some of the problems that occur if co-leaders rarely meet. Remember, we talked a little bit ago about meeting prior to the group as well as after the group to do preparation as well as debriefing. And so the extent to which there are problems oftentimes has to do with the preparation and debriefing time. So when co-leaders meet regularly, the problems are minimized. There may also be some level of competition and rivalry. So sometimes one member might feel the other is more popular or favored. And so there can sometimes be a level of competition and rivalry. Problems occur if there's no trust, respect, and value for the other person. And one co-leader may side with group members that might go against that of the other group leader. And so Sometimes group leaders have a difference of opinion. They're not always consistent in some of their own ideals and beliefs. And so that can pose a problem. But I think it's also how this issue is resolved. I always think that it's important that group members see healthy disagreement, because it can let them know that you don't always have to agree with the other person, and that you can differ with each other and still like, respect, and have a relationship with the other person. Intimate co-leaders may bring their problems to the group. So if a husband and wife pair, or girlfriend, boyfriend, or co-leaders, some of their issues or problems can spill over into the group. Also, if group leaders may be friends, if there's a friendship that occur above and beyond the group context, any relationship issues whatsoever can be a potential problem for the group process. So basically, what I've done here is just kind of highlighted some of the benefits as well as limitations associated with the group leaders. I've also talked about some of the ways of resolving problems that may occur. Prior to that, we talked about some of the professional skills that are essential for a group leader, especially with some of the specific skills that a group leader must have. And then we also talked about the group leader as a person, and so and who we are and what we bring to the therapeutic context. So in essence, I have provide an overview of the counselor and some of the factors that are most essential in being an effective practitioner in the group context. Next, what I'd like to do is talk with you about some of the ethical, legal, and clinical issues that are most relevant in the group counseling context, and that will be the third lecture of this week 1 series. So thank you for your attention. I hope that you found this lecture helpful.